Nurse! Nurse! I'm hungry!
Hey, Miss Malnourished, you pushed the call bell button. What can I do for you?
I've been here all day, and I haven't gotten a tray yet. I am starving. When are you guys going to give me something to eat?
Well, I checked your orders in Sorian, and it's looking like Dr. T has ordered you a clear liquid diet since your post-op.
Clear liquids? What is clear liquids? I'm not going to get full off of that.
Well, Miss Malnourished, we can't advance you to a regular diet until we see how you tolerate liquids. Let me see if I can get a hold of Dr. T and see what he wants us to do.
Yes, you go do that.
Okay, Miss Malnourished, here's your broth and jello. Enjoy.
Nurse! Nurse! Nurse!
Yes, Miss Malnourished. What's wrong? You don't like your broth and jello?
No, it's not that. I can't swallow. Something is wrong with my throat.
Ooh, that's not good. Let me inform Dr. T. We might have to go the nasal route. I don't want you getting malnourished because we can't get nutrients in you.
Oh no, honey. You're not sticking anything up this old nose. You don't have anything better?
Well, I could talk to Dr. T to see if IV fluids would be better, so then nothing has to go up your nose.
That's right, because nothing is going up this nose but air, honey. She must have me twisted, sticking something up my nose.
This is Dr. T. How can I help you?
Yes, Dr. T, it's RNJ over here, and we've got a frequent flyer in room 433. I'm sure you know her. She's experiencing some dysphagia, but is complaining of being extremely hungry. I informed her that we can look into a nasogastric tube because her stomach is still intact, but she doesn't want anything in her nose. So what do you suggest?
Well, looking at this progress note from earlier, it doesn't look like her GI tract is intact either. So let's try TPN. I'll go ahead and put the orders in Sorian, and you can go ahead and update her.
Sounds good. Thank you, Dr. T. Hey, are we still on for our appointment at 3 o'clock in the park?
Nurse J, you're so naughty. Make that 2:55. Well, Miss Malnourished, I looked at your consult from this morning, and it does look like we're going to have to go that TPN route.
Well, as long as you don't have to put anything up my nose, I'm okay.
All right, Nurse J, go ahead and let's get her the standard all-in-one bag. Make sure it has lipids, amino acids, dextrose, electrolytes, trace elements, and some vitamins. And page IV therapy, and let's get this central line in.
Okay, Dr. T. I'll get those orders verified as soon as you get them in, and I'll continue to monitor the patient. Hopefully this will help get some meat back on those old bones.
Old bones? I'll show you old bones. Look here, honey, you can stick me anywhere that the sun shines. Everywhere else is off limits. What's a central line anyway?
A central line is an IV that we're going to place in the superior vena cava, which is one of the largest veins in the human body. With this, we can administer a greater amount of nutrients because the blood flow dilutes all the solutions Dr. T was talking about 1,000-fold.
Oh, okay, whatever. Just hurry up and get some fluids in my body so my lips will stop cracking.
Now let's go over a few NCLEX questions. Which nursing intervention is correct for a patient receiving TPN?
Is it 1, discard TPN solution after 24 hours, 2, discard lipid emulsions after 20 hours, 3, inspect the TPN solution for clearness and visibility, or 4, teach the patient to blow out during expiration when the tube is disconnected?
The answer is 1. TPN solutions are good media for fungi, so they should be discarded after 24 hours. Let's move on to the next question.
A nurse is assisting a patient on a clear liquid diet and selecting his menu. Which choice indicates that he needs further teaching?
Is it 1, a gelatin dessert, 2, a milkshake, 3, a popsicle or similar frozen dessert, or 4, tea?
The answer is 2, because full liquid diets contain milk. Clear liquid diets contain only foods that are clear, such as gelatin, fat-free broth, popsicles, tea, and coffee.
Next question. A patient with burns on 50% of his body is receiving TPN. Which symptom indicates the client is having a complication of TPN?
Is it 1, pain, 2, absent bowel sounds, 3, abdominal cramping, or 4, increased urine glucose?
The answer is number 4, glycosuria, increased urine glucose, which is associated with high blood glucose levels, which is a complication of TPN.
Come on, level 6. Which step should a nurse take first when preparing to insert a nasogastric tube?
1, wash hands, 2, apply sterile gloves, 3, apply a mask and gown, or 4, open all necessary kits and tubing.
The answer is 1, hand washing. Clean gloves are used because the mouth and nasopharynx aren't sterile. A mask and gown aren't required. Opening all the equipment is the next step. Okay guys, this is the last question. You have 180 milliliters of milk, 60 milliliters of orange juice, 240 milliliters of Ensure. You got 5% dextrose and normal saline running at 100 milliliters per hour and 50 milliliters of water taken with meds. What's the patient's total intake for an 8-hour shift?
Is the answer 1,000 milliliters, 1,250 milliliters, 1,330 milliliters, or 1,380 milliliters?
If you chose number 3, 1,330 milliliters, then you chose right, honey.